Thank you. I'll be very brief because we want to make sure that we're doing really well on time and we stick with that. First of all, I want to thank HIV Ireland for the honour of asking me to chair this session. I'm delighted to be here. As has already been said, I am currently coordinator with Citywide Drugs Crisis Agency and have been there since 2011. Prior to that, I worked for 16 years, would have set up and established and managed the SAIL project, which is a women's drug rehabilitation project. And in both of those roles, we have worked very closely with HIV Ireland, formerly Dublin AIDS Alliance, in a variety of ways. So it's particularly nice to be asked here today. We have an extremely good relationship with HIV Ireland, and we look forward to continued collaboration. So just very briefly, there's going to be 3 presentations in this session. This particular session will end at 11 o'clock for coffee. You'll be pleased to hear. There's a 25-minute break. And I'll be from here doing the timing, so you may see me doing some strange hand signals to speakers to tell them they maybe have 5 minutes left or whatever. There isn't a planned Q&A session in this first session. However, if you have a burning question or two and it's in around the 11 and we can get through, fine. If not, there is a Q&A session in the next session if you can hold that. So if you want to ask this question, we do our best to maybe address it to the speakers who hopefully will be able to respond to you. So without further ado, I am going to call on Professor Maeve Foreman, and she's going to speak on stigma, social inclusion and policy responses over the last 30 years. To introduce her, she's a recently retired assistant professor in social work, School of Social Work and Social Policy in Trinity College, Dublin. She worked as a senior medical social worker in HIV and AIDS for 15 years and practiced in community work settings in Dublin and London, including homelessness, housing action and community law centres. She's also a former board member and chairperson of Dublin AIDS Alliance. So will you welcome, please, Professor Maeve Foreman.
While Niall's just getting up the slides, being asked to cover 30 years of social policy, stigma and social inclusion is a tall order. So I've had to be selective. I've had to leave out a load of stuff. I'm going to concentrate on those very early years because I think there's a lot of lessons for us in the early years. And and because, as Joan said, I've worked in the area. I worked in the HIV clinic for 15 years, but before that I worked in oncology and haematology. And the first consultants to work with AIDS in Ireland were the oncologists when people presented with Kaposi sarcoma, and of course the haematologists working with the Haemophilia Centre. So I very much cut my teeth with them. So I'm going to be subjective, and you'll forgive me for that. I suppose the first thing I wanted to say was some people might be familiar with the work of Michel Foucault, who was a French philosopher. He himself died of AIDS in the 80s, and he talked a lot about the history of the present and the importance of digging into the past, the genealogy or the archaeology of the past, to understand the complexity of what's going on in the present. So I think this conference is really timely because, as Joan pointed, as the Minister pointed out, last year we had an unprecedented number of people infected with the virus, a huge number among young gay men, and yet it's legal to be gay in Ireland now. We've got gay marriage. So what is it about? Why is this increase happening? So I think actually looking into the past might actually help us in understand some of that. 2 key issues in HIV, and they've been there from the very start: care and support of those with the virus, and education and prevention to prevent the spread of it. And I think stigma and the resulting discrimination impact on both, and that's really what we're here to look at today. I've been asked to, I'm going to actually use my notes, because if I don't, I'm going to talk for far too long, and Joan will be having my life there. I think it's important to just say a few words about stigma and what we mean by it. Is it about the fear of contagion still? Why did haemophilia men who'd picked it up from a blood product feel that they couldn't be open about their status, even after that fear of contagion was addressed by information campaigns? Some people might know a fellow called Goffman. He was a sociologist in the 60s, and he's the first person who began to define stigma, and he defined it as any attribute that carries a negative social identity. And his theories really influenced all the early information that came out about HIV. I think there was a belief that if people had information, they would increase tolerance and understand those living with HIV, and there'd be less fear and anxiety. But I think a lot of people later on thought that that limited the work that we were doing, and that really an understanding of power and culture and social inequality are important to really get to the bottom of HIV stigma, and that the earlier kind of definitions were too narrow in that. So, moving swiftly along. When we look at the people who were initially infected with HIV, you're talking about groups that were already marginalised in Irish society. Haemophilia men who had a disability, drug users and gay men, all on the outskirts. And I want to go right back in history, because I think it's important when we're looking at what's happening now to have an idea of what went before, and to look at the landscape of Ireland in those early days when HIV came along. 1971, people might remember there was a play recently about the contraceptive train. It was illegal to have contraceptives of any form in Ireland, so a group of women went up to Belfast, bought them, came back, waved them in the face of the guards when they arrived. As early as 1978, before there was any legislation around contraceptives, a group opened what would now be called a pop-up shop, Contraceptives Unlimited, selling contraceptives. And on the right there, the very first Gay Pride March, I think this comes out of Tony Walsh's archive, 1974, some very brave people took to the streets. And in 1983, after the murder of a gay man in Fairview Park, we had our very first Gay Pride March. So that was the landscape. 1979, the first legislation made contraceptives legal in Ireland, but only for married couples and only with the prescription from a GP. I don't know if people actually remember that far back. In the meantime, AIDS is coming down the track. 1982, the first couple of cases were diagnosed in Ireland. After that, pro-life, Smock, Society for the Protection of Unborn Children, held a really vociferous campaign and got the 8th Amendment that we're now trying to repeal put into the Constitution, which actually made it impossible to get an abortion in Ireland under any circumstances, and made it part of the Constitution. The very same year, David Norris mortgaged his house to take a case about gay rights as a human right. He lost in the High Court, he took it to the Supreme Court, he lost there, he took it to Europe, and Europe said it was a breach of human rights, and it paved the way for the subsequent legislation, and I'm sure Tony's going to talk more about that later. The Health Education Bureau, in the meantime, which was a semi-government agency and a bit more progressive than the Department of Health, tried at this point to introduce sex education into schools, and it was stopped by Conservative interests at the time. The divorce referendum was defeated. It was illegal to give information of any sort about abortion up until 92. And yet the medical evidence for women with HIV was that medically it was not in their interest to proceed with a pregnancy. It was putting their lives at risk. It was putting the lives of their babies at risk. So as a social worker in those days, to actually help people to take the boat to England, which we did, it was against the law, and we could have been prosecuted over it. And as I'm sure you're all aware, sex between men was illegal all the way up to 1973. So just from a social policy point of view, when you think about the task facing the government, facing the Department of Health at that time, there was a huge amount of social policy issues to be addressed. The first one was how to begin to tackle HIV prevention and care. There was no consultant in the country in infectious diseases or in genital and urinary medicine. The STD clinics were run by GPs at night under cover of darkness, separate clinics for men and women, usually in a side door of the hospital. There was no drug treatment. There was no harm reduction policy. The only drug users who were given Physeptone treatment, which has now been replaced by methadone, were pregnant women. There was no other treatment. And as a result, Like in London, there was drug treatment. A lot of Irish drug users travelled there. But when we got the HIV test in 1985, 60% were drug users. London, which would have had a much bigger drug population, the incidence of HIV was tiny among drug users because they had drug treatment in place. So how to do a public awareness campaign about safer sex when nobody talked about sex and it was illegal to be gay. The role of the church in social policy, again, was very, very strong. And I think I've probably covered all of that. And as you can see, I'll be building towards the fact that we had no sexual health strategy at all. And from the mid-90s onwards, there was an increase in people coming to Ireland particularly from sub-Saharan Africa, which again brought an increase in HIV from those areas. And I know PJ is going to be talking about the issue of migrants. I just want to say a word about the haemophilia community as well, because that's where I first cut my teeth working in this area. And I think it's a really good example of how activism and advocacy can actually get you places in this country. And sometimes if you don't push, you don't get. People may remember that the haemophilia community, they were devastated by Hep B in the 70s, HIV in the 80s, and hepatitis C in the 90s. And their campaign for compensation actually led to a defeat for the government in Parliament in 1989 and the election of 1989. And they eventually did get a good compensation package, but it was not without a lot of hard work on their part. And I think one of the positive outcomes of the Lindsay Tribunal, which explored that whole scandal of the infected blood products, was the recommendation that the National Treatment Strategy for haemophilia included collaboration and participation with those directly affected. So that model of collaboration began to emerge as one of best practice. But back to what was happening when HIV came down the track in the early 80s. The first responders, and I think Susan's archive down at the bottom, if people have had time to look at it, is a really good example of all the material that was produced in those very early days. And a Liffey project was already in existence, so they were dealing with the fact that a huge number of their service users were testing positive to HIV. Gay Health Action came together. It was a lot of people from the Dublin Gay and Lesbian Collective, who the following year produced a book called Out for Ourselves, which was the first book on Irish gay lives. And again, at a time when it was illegal to be gay. So again, very brave people putting themselves out there into the public arena. Gay Health Action produced the very first leaflet on HIV over a year before the government did. And they used very explicit language. They talked openly about fucking and sucking and spoke the language of people on the street. And they really, not just for gay men, but for people generally, were the first source of information. People in Gay Health Action were involved in setting up Cordia, so I'll say a little bit more about the two of them. And I've just listed a lot of other different organisations. AIDS Action Alliance, I'll say a little bit more about as well. But when you just look through the list, AIDS Fund, Practical Aid, Comfort Aid, a lot of these were started by people with the virus who are no longer with us, but they put a lot of time and energy into creating services and supports for people who needed it. The Quill Project, we're going to hear from Mary later. And there was an annual memorial service every year that the Quill Project were involved in, where people handed up quilts that had been made during the year. AIDS-wise, ACID, Open Heart House, which is no longer with us. And then housing projects. The AIDS Fund Housing Project was actually started by one of the first HIV counsellors in the Eastern Health Board's AIDS Resource Centre, Paddy McGrath. And I'll say more about the different body-positive groups that have come up along the line. There's just some of the first leaflets from Gay Health Action. And I think when we're thinking about Foucault's history of the present, it's really, I was just looking at the current board of Gay Health Network, which is a current really good example of gay organisations, HIV organisations, working with the HSE. And people like Mick Quinlan, who was there at the beginning of Gay Health Action, Kieran McKinney, who I think was one of the first workers on a social employment scheme in Gay Health Action, Donald Traynor, who was the administrator for AIDS Action Alliance in '86, they're all still involved. So I think that language that Gay Health Action used, Mick Quinlan actually went on to direct the Gay Men's Health Service within the HSE. And if you look at the Gay Men's Health Service early leaflets from the early 90s, the same language, the same overt speaking to its community language are evident. So I think the fact that they were able to move into the Eastern Health Board and subsequently the HSE was a really good one. There's just some more of the Gay Health Action. They never received formal funding. It was really an interesting time. The Department of Health couldn't be seen to be funding leaflets that were proposing activities that were illegal. The Health Education Bureau did give them, I think it was £700 for that first run of leaflets. The Department of Labour funded social employment scheme workers, but the Department of Health wasn't formally connecting with them. Cordia, I've mentioned, I don't know if people would remember that Cordia was set up by people involved in Gay Health Action. The Irish diaspora in America, in Australia and in England were very important for us because we were able to reach out to them, get information from them. People from the Shanti Project in San Francisco came over for a conference in Trinity and trained up the first volunteers in the Shanti Project model. And it was about supporting people in the community to die at home with dignity and respect and help them in any way that they could. And from our point of view in the clinic, it was really important because in the beginning there was 2 HIV counsellors in James's. We eventually in the 90s got the number out to 6, but we were dealing with a couple of thousand patients. We really needed support in the community. And in the absence of a palliative care team or a hospice beds for AIDS patients, Cordia employed 2 palliative care nurses who came into the clinic and worked with us, and we worked directly with them and referred patients to them. It was some time before the Irish hospice, when they got enough money, opened up beds to patients, and then the Cordia nurses actually went and worked with them in their palliative care team. AIDS Action Alliance, which is actually the roots of Dublin AIDS Alliance and HIV Ireland, was founded in '86, and it actually brought together existing organisations, Body Positive, which was people living with the virus, Cordia, Gay Health Action, Lesbian Health Action, Women in AIDS, Practical AIDS, and alliances in Cork and Galway, all under the one umbrella. So it's interesting to look at how organisations have changed and evolved over this time. They produced lots of good leaflets, and subsequently Dublin AIDS Alliance was established with AIDS Helpline, Body Positive, Cordia, and Irish Frontliners, which again was a group of people with the virus who produced a really good magazine. They linked in with groups in America. They shared a lot of up-to-date medical information at the time. So back to the Department of Health. The Department of Health, in preparing for today, I had a good read of Anne Nolan's PhD, where she looked at the impact of the first decade of HIV on sexual health policy in Ireland. And she referred to the Department of Health as the cautious procrastinator. Barry Desmond, when he became Minister for Health, he brought in an act, 1985, permitting the sale of condoms to people over 18. But again, only in chemists, only in pharmacies. So it was quite restrictive. James Walsh was appointed, he was the Deputy Chief Medical Officer. He was appointed National AIDS Coordinator. And he had a very public health approach to HIV and AIDS. So he was a good person to have at the helm in terms of being willing to work with organisations that were on the ground. And he would have appointed AIDS coordinators around the whole country. I think the initial plan was that each area, each hospital would look after their own. It was never intended that James's Hospital would become a kind of a primary centre of care for HIV, but by default, that's actually what happened. And it's interesting, and again, you can see all these down the back. The very first Health Education Bureau leaflet, which was produced in '86, just talked about unsafe forms of sexual activity when it was talking about sex with men. It was not in any way explicit at all. The next in terms of social policy and change that I wanted to talk about was the impact of the task force on AIDS that was set up in '86 by a priest called Paul Lavelle, who was part of the Catholic Social Service Conference. And this was the the first time that, is that 10? Okay. This was the first time that different forces involved were pulled together, and crucially, Paul Lavelle included Gay Health Action and Cordia in the task force that went on to become the National Bishops' Task Force on AIDS in '87. So the fact that the gay activist organisations were included in the task force gave them legitimacy and a vehicle, a way of talking to the Department of Health. People like Chris Robson, who was involved in setting up Glen, it's on record, I think 2 years of letters to the Department of Health from '85 to '87, acknowledged but not answered, and no meetings given. But after they were part of the task force, they got to meet with the minister, they got to have those lines of communication. So that was all very important. The government's first campaign, I won't actually go into the link because I'm going to run out of time. The first one to come into our sitting rooms was the English one, which was pretty horrible, and it instigated fear rather than understanding and acceptance. Don't die of ignorance, it was called. And it was followed by our own campaign in 1987. By then, the Minister of Health was Rory O'Hanlon, and he might be father of our famous comedian from who performed in Father Ted. He was a staunch Catholic. So the campaign, AIDS Don't Bring It Home, Casual Sex Spreads AIDS, was the message. There was nothing about safer sex. One of the kind of crucial events for me as well, in terms of creating good, positive, anti-discriminatory sexual health policies in the area, was the Irish AIDS Initiative in 1988. And this was the first time that all the players came together, the Department of Health, Health Board, and the AIDS Liaison Forum. Did I go back there? No. I've missed out on the AIDS Liaison Forum. They're in here somewhere. There it is. We all came together to have this conference. It involved people with the virus. They very much were in the steering seat. And it began to look at how best to develop a HIV strategy. It led to the forming of the AIDS Liaison Forum. And this was a forum for people with the virus, people working in the area. We connected with some groups in England. There was a group called Positively Irish Action on AIDS in England, because all our drug users were travelling there. A lot of gay men were travelling there. We would all have worked together and lobbied together and produced our own newsletter. And this was a real source of information and support, for particularly for those people working in isolated areas around the country. From a social work point of view, we also had a special interest group trying to develop good practice. There were a lot of ethical issues were coming up, particularly around confidentiality. We worked with some women with the virus to produce a children's book called Ciara's Story, because the paediatric AIDS clinic in Crumlin, the numbers there were growing all the time. A lot of children were not being told what their condition was because of fears of disclosure and confidentiality. And Alf eventually worked with the Health Board and the Department of Health in this conference, sharing the challenge. Now we had Mary O'Rourke, Minister for Health. So she actually announced the setting up of the National AIDS Strategy Committee. Prior to that, the Department of Health did have a HIV care and treatment policy from 1990. And part of that policy said we should have a National AIDS Strategy Committee. And it's very much modelled on the Bishops' Task Force, you know, where all the parties involved were included. And I think the Bishops' Task Force, despite the fact there was a conservative Catholic environment, that the task force itself, led by Paul Lavelle, was quite progressive, and it set the scene for including all the component parts at that time. So progress in the 90s. I was reading Anne Nolan's a PhD with her there the other day, and she thinks 1991, Charles Haughey, who by then had become Taoiseach, said condom law would be refined, which it was eventually in 93, and he saw no need to consult the Catholic hierarchy. So she and others would see this as the beginning of the end of church influence when it comes to sexual health policy in Ireland. So it's something to be marked. The Health Board, meanwhile, opened the Women's Health Project to work with women in prostitution, and the Gay Men's Health Service. And as I said, crucially, Mick Quinlan from Gay Health Action moved into it. And I think people who cut their teeth with Mick include people like Michael Barron, who went on to belong to the Gay Youth Group, which has done such great work with the Department of Education in challenging homophobia in schools. And I better move swiftly along. Okay, I'm just going to skip some of these because I'm going to run out of time. The National AIDS Strategy produced 2 reports, and I'm sure Susan has both of them there at the back, the 92 one and the 2000 one. And the 2000 one is the one that began to talk about the need for a sexual health policy, though the NASC itself did very little about it. Its subcommittees were a bit more active. The care and education, the care and management and the education and prevention subcommittees both produced reports, both proposed progressive strategies in terms of care and prevention. Just a little bit about collaborative practice, which was very much coming up at the time. The Gay and Lesbian Equality Network did a report on HIV prevention strategies and subsequently got money to have a gay HIV prevention officer who worked with gay communities around the country, introducing them to their health boards and encouraging collaboration and cooperation between health boards and the gay community. And another good example, which we've heard mention of, was the Stamp Out Stigma campaign, which brought together organisations and workers within statutory services together to develop a stigma campaign, and I'm sure we'll hear more about that throughout the day. NASC did commission with the Crisis Pregnancy Agency the relationship and study of health and sexual relationships in Ireland. That came out in 2006. It was still 9 years before we got our sexual health strategy. And again, it's interesting to look at how things move and shake in Ireland and what eventually got us that strategy. A couple of consultants, Colin Bergen and James's Alan Lambert in the matter, eventually through the Royal Physician Society, wrote a report in 2012 saying sexual health has to be part of our national health strategy. Groups like HIV Ireland, other voluntary groups were pressing for it too. But we did eventually get it in 2015. From the mid-90s onwards, and I'm sure the other speakers are going to bring us a lot more up to date because I'm going to finish in 5 minutes. Okay. From the mid-90s onwards, HIV became a treatable disease. And I think for a lot of, from a social work counselling point of view, it was the re-medicalisation of HIV. Up until then, counselling and support were very much central to the care package people were offered. But once the treatment came on stream, people were not automatically referred for counselling and support. And that was an issue for us because the stigma and discrimination and the subsequent non-disclosure still existed. HIV was made a notifiable disease in 2011 after a lot of debate and a lot of disagreement on our side because it was against UNAIDS' idea of best practice. But so far so good. I think it's been working quite well and is arguably partly responsible for the increase in figures that we're seeing. We now have PrEP is still in the pipeline, and I'm sure there'll be further discussion today about the importance of the government funding and introducing a programme on PrEP. And the rapid testing that was mentioned earlier as well, it's brilliant to see something like that. Again, health boards and the HSE and community groups working together for that. Briefly mention, I did a study with Nancy Rahal in James's Hospital a few years ago, and we came to the conclusion that HIV is not just another chronic illness. Stigma and discrimination was still very much an issue, especially within the gay community. People who were positive going onto sites like Gaydar and Irish sites were meeting a lot of hostility, a lot of discrimination. So difficulties around disclosure and less availability of support were all issues. And the importance of peer support really shone through. The thing of stigma resistance is something that I think we really need to help build in people with the virus as well. One of the people we interviewed said, I've no problem with being who I am because it is who I am. So if I need to tell somebody and they reject me, that's not my problem, that's their problem. And I think if we can engender the strength and support for people to actually say, you know what, it's not an issue, it will hopefully help things. I really want to acknowledge all the peer-led initiatives that go way back to 1985, Body Positive, Frontline, I was talking earlier with some people and we were remembering Mal-AIDS, which was started by people with the virus, and they used to come into the clinics and talk to the service providers to try and challenge and improve what was happening. And the more recent one, Our Responsibilities, which is acknowledging the shared responsibility of all of us to challenge stigma and discrimination. And I think, again, going back to Michael Foucault and History of the Present, I think we need, when you look at what happened in the past and how change was affected, it was usually a mixture of good leadership, individuals who were prepared to put their neck on the line, and good collaboration between all the stakeholders involved. They're just some of the people that some of you will remember. Tom McGinty was great because he was a celebrity, the Dice Man, and he used it to go public and to talk publicly on programs like The Late Late Show with Gay Byrne. Pat Tierney was somebody who used pick at the hospital to try and do away with the policy of closed coffins and the use of body bags. Linda Reid was very involved in Dublin AIDS Alliance. She was involved in the International Network of Women with HIV and ran women's support groups here. And Noel Walsh, I'm sure you're all familiar with from his GCN column. And he also would have done really useful research with the clinics to improve services for people with the virus. So we need to challenge stigma and discrimination. We need to work together. And I think this is something that I've got from Anne Nolan's PhD as well. You can just see how HIV forced Ireland to reconsider its view of sex. We used to think it was dirty, sinful, keep it under the carpet, not talk about it. And we've evidence of the power of collaborative approaches between civil society, and government, between frontline workers and those living with HIV, and between different organisations working on the ground. And I think the Gay Health Network and the HSE campaign Men to Men is a really good example of collaborative practice and how effective they can be. So just back to my original slide, the two key issues, care and support and education, and the impact of stigma on both. Stigma is curable, and I think that's the one thing that we can come together on. So I'll end there.